So in this video, we are going to introduce you to schizophrenia and primarily looking at the characteristics. So this is the first section of your learning about this behaviour. So for Unit 3, you will be learning about different behaviours. So schizophrenia will be the first one that you learn. You'll need to know the characteristics, the biological explanations, the individual differences, the social, and the methods of modification. So these notes that I've just made will go alongside all of the different behaviours that you are learning. So the first one that you will be learning is schizophrenia, which we're going to cover in this lesson, focusing on the characteristics. So this is part of your A2 studies, and it is the section where you are looking at implications of the real world. There is a 2.5-hour exam for this assessment. So in this, you will cover the behaviours that you learnt as well as some other aspects, which I will explain now. So the study of the behaviours in section A, you will have questions about a possible of 6 behaviours. So in normal years, you are given 3 different behaviours. So we will learn the different components I mentioned on the first slide for each behaviour. So you will have to know the characteristics of the behaviour, understand the biological, individual, social explanations for the behaviour, and evaluate all of those, as well as understanding and being able to explain and apply the methods of modification for the behaviour and to evaluate these. So the methods of modification of the behaviour could be anything such as rehabilitation, a therapy, or interventions with drugs and so on. So while you're studying schizophrenia, you'll have to cover all of these and know at least 2. Here are some possible examples of what we will be learning and what we will be covering for each topic. So for Unit 3, this is 60% of your A2 grade. This is split into 2 sections. So Section A is the study of behaviours and Section B is the study of controversies, which we'll come to later in the year. As we are covering schizophrenia, criminal behaviour and addiction as a whole college, you will be learning about these. So within these, you have to use your assessment objective knowledge that you've built up over the years. So there's a lot of description, more application than you are used to, more than there was at AS, and a lot of evaluations as well. So to diagnose someone with schizophrenia, you need to use a diagnostic tool. So there are 2 that we are going to discuss today. So there is the ICD and the DSM. The ICD is currently on its 11th edition, but there is far more research on the 10th, so this is often used. The DSM is on the 6th edition, but most recent with the most amount of research is the 5th edition. So the 10th and the 5th editions tend to be referred to more commonly as they can be more reliable and valid as more research has been put into them both. So the IDC stands for International Classification of Disease, and this has been released by the World Health Organization, which is commonly abbreviated to the WHO or WHO. So the ICD, currently on its 11th edition, is free for anyone to access. You can use the search engine to find this and you're able to go into it and find any information that you need for it. So this International Classification of Disease manual is for all disease. So this is run by the World Health Organization and it covers the diagnostic criteria for all diseases. So here we've got the description for schizophrenia. So it states that schizophrenia is characterised by disturbances in multiple modalities. So this is including thinking, perception, self-experience, cognition, volition, affect, and behaviour. The DSM-5 stands for the Diagnostic and Statistical Manual of Mental Health Disorders. And this is developed by the American Psychiatric Association, abbreviated to APA. So the DSM is a standardized classification for mental disorders used by mental health professionals in the United States. So first of all, it's a standardized classification system just for mental disorders, whereas the ICD is for all health disorders and conditions. And this DSM is only used in America, whereas the ICD is a worldwide, readily available diagnostic tool. The DSM-5 is also not free to use. You have to buy a copy of this in order for you to be able to access it. So there are quite a few things to unpack there. So if the DSM is only used in America, but the ICD is worldwide. The DSM costs, or it should be this really, but this one is free. So we can see there's some stark differences between the two diagnostic manuals here. So if the DSM costs money to use, but we're able to use this would suggest that this would be the better tool. However, to meet certain people's agenda, more research has been ploughed into the DSM. So this means that it's more valid and reliable. So an argument could be made that it's more valid and reliable because of that. But also due to the locations of these two manuals being used, there are cultural differences. So this just highlights that there are some slight inconsistencies within the diagnosis process of schizophrenia. Largely, the ICD and the DSM both have very similar interpretations of schizophrenia and the characteristics of it. So for the purposes of learning about it, we focus mainly on the DSM as it's got more research that we can fall back on. So on the next few slides, I'm just going to chat to you about some resources which may be very useful for you while you're studying schizophrenia. So it is a requirement on this course for you to watch A Beautiful Mind, which stars Russell Crowe. This is a true story of a mathematician who has schizophrenia. So it's a really interesting way of pointing out and noticing the characteristics that we're going to look at coming up in the rest of this video. So I would urge you to go and watch that. There is a link on Canvas where you can watch it for free. Another good film for identifying characteristics is Shutter Island. So although this isn't a true account of someone's experience with schizophrenia, it's quite a nice way to identify characteristics and to put the knowledge that you'll learn from this video into practice. And then finally, there is The Soloist. So this is similar to A Beautiful Mind. This is a real story about a musician who's got schizophrenia. So by watching these films, it'll help you develop your AO2 skills, which you haven't really used as much as your AO1 and AO3 last year. So it is something you're going to have to start getting used to. So I will try and give you lots of materials to help you with that. So please watch at least A Beautiful Mind and hopefully one of the other two. Some other good things that are worth noticing are some good books to help assist in your learning. So Bad Science talks about how to conduct research properly, which is going to be really important while you're studying everything in psychology, but schizophrenia in particular, as we look at lots of research and how we apply the knowledge that we gain from research into our understanding of schizophrenia. Bad Pharma is discussing how pharmaceutical companies employ sneaky techniques to make their drugs look better than they actually are. So this will be very useful when we come to the lesson where we look at methods of modification for schizophrenia. Here are some other books which may be useful for you. So the first one is a collection of stories from the early career of clinical psychologists. The second looks at how the brain influences behaviour and indeed that of schizophrenia. And then the final book is the history of mental health treatments. So really fascinating to see how they have developed over time and useful for all of your psychology studies. Okay, so before we learn about the characteristics of schizophrenia, I want you to be aware of what comes up in the assessment at the end of the year. This is so you know why we're learning certain things, and it'll hopefully help you to develop your ideas of these topics as we learn them. So first of all, exam questions about the characteristics will only involve description. So when you are talking about characteristics, you will only need to use your AO1 skills. So there's no point in evaluating, and we will not evaluate them here. We will also not be applying them. So next up, your answers must be thorough and accurate using effective terminology. There's going to be a lot of new language in this video that you may not know. So you will have to know it very well and use it in an accurate way, thoroughly describing what you're talking about so that you can gain the highest marks possible. It's also important to demonstrate in both depth and range different characteristics. So you have to explain as many as possible in a very deep way. So you can't just very loosely, generally, broadly talk about things. You also need to present your work in a logical and coherent answer. So that is by using certain structures that have been taught to you. So there's a range of different structures that we've went over last year. You can use any of those. And then for a 10-mark question, you have about 15 minutes to complete it. So please be aware of things like this. You should start timing yourself now, because this will be when you are gearing up for your exams and getting ready and prepared for your end of year exams, which will be here sooner than you know it. So as we know from looking at the ICD and the DSM's description of schizophrenia, we know that the characteristics of the symptoms involve a range of cognitive, behavioural and emotional dysfunctions, but there is no definitive one symptom for the disorder. So the diagnosis involves recognising a cluster of signs and symptoms associated with the impairment of occupation and functioning. So this means things such as school and work and your everyday life. So before the appearance of typical schizophrenic symptoms, there is sometimes a period of weeks or months, and particularly in young people, in which the prodrome of non-specific symptoms appear. So prodrome is the early symptoms that indicate the onset of a disease or an illness. So with schizophrenia, they are these. So it'll be the loss of interest in usual activities, avoiding the company of others, staying away from work or school, being irritable and overly sensitive, lack of interest in personal appearance and hygiene, generalised anxiety, and mild degrees of depression. So by having a few of these rather than just one or two is a good indicator that something such as schizophrenia may be manifesting. So this will give the idea to start looking into diagnosis. These obviously can indicate a range of different things, but these are the prodromal symptoms for schizophrenia. So there are two types of symptoms of schizophrenia, and those are positive and negative. Positive symptoms of schizophrenia are where things are added to typical behaviour. And then for negative symptoms, this is when things are taken away from your typical behaviour. So if you consider in maths, the plus sign tends to indicate a positive, and the symbol for taking away something indicates a negative. So if you consider the symptoms in terms of positive will increase untypical behaviour, and negative symptoms take away from typical behaviour. Okay, so with positive symptoms, when we are adding to someone's typical behaviour. These are things such as hallucinations, delusions, and disordered thinking. So in most persons, we will not see these sorts of things. So this would indicate that things have been added to typical behaviours, as these characteristics are not typical of everyday behaviour in persons who are deemed to not have conditions such as schizophrenia. So with hallucinations, they are characterised as being perceptions that are not true. They can come in three different forms. So we have sensory, auditory, and visual. So these are the key ones. So auditory would be hearing something that isn't there. Sensory would be sensing something that isn't there. So, we have several different senses. So they are anything that would not be to do with auditory or visual. So this could be taste, pain, and so on. And then visual hallucinations would be where you see something. It's also worth noting that about 20% of people with schizophrenia have tactile hallucinations. So this is the feeling of something on your skin. So it could be the feeling of being tickled or bugs crawling on you and so on. And we then have delusions. So these are beliefs that are unreal. So there are many types of delusions, but commonly held delusions are those of persecution, grandiosity, and reference. So persecution, first of all, are based on the idea that a group or an organisation want to harm the person. So, for example, believing that a government organisation such as MI5 are actually following you and they're after you because you are a threat to national security. So being persecuted against is an act of hostility and ill treatment, especially because of something very innate within you. So lots of people with schizophrenia tend to think along these lines of that someone's out to get them and that they are being persecuted. Grandiosity are based on ideas that an individual is special in some way. So the individual believes they are powerful or they're superior, and they've got knowledge that they assume the identity of sometimes a historical figure or a very important figure. So this could be that they are a religious figure. Often people will think that someone very famous from time, such as that of Winston Churchill. And then delusions of reference are based on the belief that certain gestures, comments, and environmental cues are directed to oneself. So, for an example, an individual may believe that TV or newspaper articles are actually communicating a message to them. So this could be every time that somebody uses the telephone on a TV programme, they could think that it's assigned to them. Or similar in content analysis, they could be looking for codes and clues within the text, and they could feel like there are external influences being communicated to them. So persons with schizophrenia can experience all three at once. So often people could, as an example, believe that they are a religious figure such as Jesus and they are trying to be persecuted against because of the background story of the Christian beliefs, and that there are clues everywhere in their environment telling them that they need to get to safety and so on. So there's a range of different delusions that people can have, and they're all very unique to that person. Disordered thinking is normally shown by examining speech of individuals with schizophrenia. So the person's thoughts and discourse seem to jump from topic to topic with no apparent reason and show no logical flow within their discussion. The patients may seem a little muddled and incoherent, which can prove to be very frustrating for the persons trying to communicate with them and for the individual with schizophrenia. The patient also sometimes reports that the thoughts in their head may not be their own, and this is called thought insertion. And this is typically where they believe that a third party has access to the thoughts and they are experiencing those. So from all of the examples that we've just looked at, you can see that all of them have added to typical behaviour. So none of these characteristics and behaviours are something that you would see So now the negative symptoms, where things are going to be taken away from typical behaviours. So you'll see here that there's quite a few new words that you may not know, but we'll cover all of these in the next few slides coming up. Alogia is referred to when we mean poverty of speech. So when someone is finding it difficult to speak or is unable to speak. So this is when there is a reduction in the amount of total words used. So remember, we are reducing typical behaviours with our negative characteristics. So people with schizophrenia lack meaning in their speech because they've lost that. So they've lacked in something. So this is typically when persons with schizophrenia are finding speaking very difficult. They can have very short, quick answers, and they may completely stop speaking. Abolition is where people seem indifferent to things that they would typically engage in. So they would withdraw themselves from different situations. So this occurs when people seem to be indifferent or unconcerned with things that are going on around them. So it's closely linked to their lack of desire of taking part in these activities, and a lack of goal-directed behaviour is shown. Anhedonia is when the individual does not react appropriately to something they should normally enjoy. So if you enjoy being on the beach, once you are there, you don't know how to act and you end up coming across as very melancholy. So another example of this is if a rugby fan was to not demonstrate any pleasure when their team was winning. So if you consider something that you know that you'd have a normal reaction to and that being taken away. So again, the reduction of a typical behaviour. Flatness of effect is where the individuals appear to have no emotion. So you can see all of these are linked and can typically go together. So with flatness of effect, this could be when there is something such as a funny joke being told to you and you're unable to smile or laugh. So with flatness of effect, it may show little or no emotional expression, such as smiling or frowning. And the speech patterns tend to be very monotonous and do not rise and fall like normal speech patterns would. So next is catatonic behaviour, and this is a significant decrease in someone's reaction to their environment. So there's quite a few different types here. First of all, we've got stupor, which is the state of near unconsciousness or instability. Motor rigidity, which is where you may be stiff or the muscles can't be flexed at all when you're inflexible. Individuals may display fast, repetitive movements, or they could have little or no movement. There's also echopraxia, where they may mimic movements from others that are around them, and the individual may remain immobile for long periods of time, or they could be in seemingly uncomfortable positions for a very long time, and when attempted to be moved, they may become very rigid and unable to do that. And also people may adopt bizarre positions and facial expressions. So you can see here that there are a range of these different things shown, where people may become rigid and they've got odd behaviour. So this may seem like a positive, but it's actually a negative symptom of schizophrenia because it's taken away from your normal functioning. So none of these behaviours are common in typical behaviours of people who do not have mental conditions or physical conditions. So therefore it's a negative symptom. So as we've looked at already, the ICD and DSM are used in tandem, and there are cultural biases which go along with these. However, there are further cultural biases. So both of them are based on Western ideas of mental health. So this is not the only idea of mental health, as some cultures may deem things such as hallucinations and delusions as a good thing. So there are instances where speaking to God and hearing God and thinking you may be affiliated with God is a good thing. And some cultures may find this fascinating and deem it as a blessing rather than as a mental health condition. So we need to understand that Western ideas of mental health are not the only ideas of mental health, and that the DSM-5 from the USA and the ICD from the West are not the only ideas about mental health. So we're going to look at a mark scheme now so that you know what to pay attention to. So although it says, as indicated by the DSM-5, you do not need to really specify that you are talking about the DSM-5 or not within your answers. This is just indicating that we are going with the characteristics as identified in the DSM-5, but all your handouts and resources will be related to this. So use the materials that you've been given and you will cover all the things that you need. So to gain the top marks for these types of questions, which are an AO1 because they're just talking about the characteristics and we cannot evaluate the characteristics. So to gain the top marks, you will need to describe the characteristics of schizophrenia thoroughly and accurately. So you need to make sure you go over things in depth. You cannot just skim over the topics. You also need to make sure that there is depth and range to the material that you've included. So you need to cover things very well. There's also an effective use of terminology throughout. So you've learned a lot of new terminology today. So you need to make sure that you use that effectively and accurately, and that structure is logical and coherent. So using any of the structural formats we have looked at before will help you do so. So for the question, before the marking criteria, it states credit can be given for delusions of persecution, grandeur, reference, or of control, hallucinations with several different types, disorganized speech, which you can refer to as word salad as well. However, this would not be classified as correct terminology. This would. Disorganized behaviour, so this could be lack of inhibition, bizarre and unpredictable, and also some negative symptoms, and then you go on to speak about them. You can also describe anything else that is relevant, which has been missed out of this picture. So for the lowest marks for this question, you would either have to give an inappropriate answer or no response. So by being aware of what the lower markings are and what the difference between the grade boundaries are, you'll be able to make sure that you are hitting the top grade boundaries. So description of schizophrenia is superficial. So this would be if you've given a very basic answer. Little use of appropriate terminology. So this is where you are not using the correct words. And answer lacks clarity. So this would be if you were just rambling on about hallucinations in a very broad way. So hopefully you've got a good understanding of the characteristics, both positive and negative. Hopefully you have a good introduction to schizophrenia and you started considering the diagnosis process. Please check the handouts and the materials on OneDrive to help you. So thank you for watching, and if you have any questions in the meantime, please check the resources on OneDrive and contact me if you need help with anything.